it's Jenny again. So I just want to talk to you about some complications and things to know about insulin. If you have a medium or long-haired dog or cat, and one day you're going to give your insulin and you think that you're in this pocket, you tent the skin, you think that you're in the skin, and you give the insulin and it turns out you're not in the skin, or your needle's gone through and through and the insulin runs down the side of their body. You will know because insulin smells like Band-Aids. If you've ever opened a fresh box of Band-Aids, that's the exact same smell that insulin has. So you will smell that and then it will be wet on your pet's fur. We don't want to re-give the insulin. You don't know how much your pet actually got, so it's better to not re-give and just wait until the next dose at dinner time, and that's perfectly fine. If your pet licks the insulin off of them, that's okay. Insulin is not absorbed well orally, which is why there's no oral form of insulin, and it's only ever injectable. If your other pet licks the insulin off your dog, it's fine. Like I said, it's not well absorbed orally, so it will be fine. If you find that your pet is exhibiting symptoms of hypoglycemia, which is low blood sugar, what happens is there's too much insulin in the body and not enough sugar, okay? So they might start walking wobbly, like they're drunk. They might bump into things. They might seem very disoriented, groggy, not really responding to you the way that they normally do. If this happens, and you suspect that your pet is having a low blood sugar, you can offer him a meal or her right away. Offer some food. If they eat it and the symptoms get better, that's great. You want to make a note of it and you want to let your vet know. If the blood sugar gets too low, they can have a seizure. So if that happens, don't panic. Once they're done having the seizure, you want to take Karo syrup, honey, maple syrup, and you want to rub it on their gums because the sugar will be absorbed through the gum tissue, and you want to bring them into the ER right away so that we can give them IV dextrose if they need it. If you go to offer your pet a meal and they don't want to eat, you want to you want to err on the side of caution and take some honey or Karo syrup, rub it on their gums, come into the ER if there's a problem, so that we can help you with whatever it is. The other thing is, if you're having a crazy hectic morning and you know you fed your pet but you don't remember if you gave the insulin or not, don't give it. Just err on the side of caution and don't give it and wait until dinner time. That's how, insulin overdoses happen and hypoglycemia happens. It's usually when there's a double dose, or, sometimes I've had people give their pets insulin even though they're not eating. Big thing a very big important point in diabetes management is that we never give insulin without feeding our pets. They must eat at least 50%, okay? Because if you give them the insulin and they're not eating, there's gonna be nothing to absorb it and they're gonna have a low blood sugar. So you always feed first. And different doctors will have different criteria, but the rule of thumb is if your pet eats less than 50% or just takes a couple bites or a couple licks of their food, you want to give a half dose. So if you're giving 4 units twice a day, you would then just give 2 units. And then if the same thing happens at dinner or they don't eat at all, you don't give any insulin. And then the next morning, you want to let your vet know, give them a call. If they're not eating by the next morning, you need to call the vet. Because your pet has diabetes and it affects everything in their body, if there's a problem like diarrhea or vomiting or not eating, you want to let your vet know right away. You don't want to wait, because if they're not eating or they're vomiting, you can't give them their insulin, and that's really important. They need that. So that's just a few things that can happen with insulin. If your pet does become sick and is vomiting, having diarrhea, not eating, sometimes they get a condition called pancreatitis. Animals with diabetes are very prone to that. In those cases, their blood sugar is going to go way up. If your animal gets any kind of an infection, an ear infection, tooth root abscess, anything, it causes the blood sugar to go up. So you can have a pet that's very well regulated, and then out of nowhere they get sick, and now their diabetes numbers are everywhere. So you always want to come to the vet right away. You want to avoid a DKA situation, which is diabetic ketoacidosis. I talked about that a little bit earlier, where the pet is burning ketones instead of burning glucose for fuel. Or they're burning fat, I mean. If they are not able to get their insulin because they're not eating and they're nauseous and vomiting, their blood sugar is going to continue to rise, and they will start to produce ketones, and then because they're burning fat instead of glucose. So all of these things mean you need to either come in through the ER or call your vet and get an appointment. You don't want to wait on it. DKA is a severe complication of diabetes that you want to try to avoid if possible. Those are just some of the things that you need to know about insulin and about giving insulin, and things that can happen with your pet.